Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the National Native Network webinar series on cancer risk reduction in Indian Country. This webinar is titled Native Cancer Wellness. This technical assistance webinar is being hosted by the National Native Network, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian Country and the Indian Health Service Clinical Support Center. Your presenters today are Dr. Klimant, Dr. Krisstina Gowin, and Roberta Basch. Dr. Klimant, prior to joining the Salish Cancer Center, was appointed as the Director of Integrative Oncology at Cancer Treatment Centers of America in Philadelphia, Pennsylvania. He has also served as Medical Director and later as Chairman of the Department of Oncology and Hematology at the Marshfield Clinic in Weston and Wausau, Wisconsin. At the Salish Cancer Center, Dr. Klimant works within a multidisciplinary team to provide patient-centered cancer care. The integrative care model puts the patient at the center. Patients' needs are addressed on multiple levels, including innovative scientific cancer treatment, spiritual and psychological support, naturopathic medicine, and an individualized nutritional program, he says. Dr. Gowin of the Salish Cancer Center graduated from Chicago College of Osteopathic Medicine in 2009, where she received a merit scholarship and recognition from the American Women's Medical Association for outstanding academic achievement. With several peer-reviewed publications and research protocols, Dr. Gowin is a dedicated researcher with ongoing clinical trials in yoga, tai chi, and novel therapeutic combinations in a type of chronic leukemia. She is regarded as a national expert in the field of Dr. Gowin, can you help me with that? Dr. Gowin is passionate about integrative medicine and is committed to supporting patients through their journey. Roberta Basch is a Palala tribal member with close familiar ties to the Squamish, Yakima, and Indian tribes, in addition to being taken under the wings of the Northwest Native cultural carriers. Roberta also learned from the Eiko Indian tribes of the Sierra Madre of Mexico, who in their language are healers. We are pleased to offer continuing education credits for participants in this webinar. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses. To obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey. By the end of this webinar, participants will be able to identify the unique challenges of the Native American cancer patient population, examine the integrative model of oncology care, and recognize the benefits of combining traditional healing services and the care of Native American cancer patients. And now at this time, I'd like to present Dr. Gowin.
Thank you so much, Mike, for that very lovely introduction. And I'm very honored to be speaking on today's National Native Network webinar series. And today we'll be discussing Native cancer wellness. And again, my name is Dr. Krisstina Gowin. I am a medical oncologist and integrative medicine physician. And you'll also have the opportunity to hear from Dr. Eiko Klimant, who is our medical oncologist and a medical director here at Salish Cancer Center. And then Roberta Basch, who is our Native American Outreach Coordinator, will also be introducing some very Native-specific topics. I'm very honored to have her speak with us today. Can you advance the slide, please? So we do not have any disclosure. Thank you. Pardon me, we're having some difficulty advancing our slides. So now we're going to address the objectives, and that was also presented by Mike. Thank you very much, but we'll just re-identify what we'll be speaking today, and that is the unique challenges of the Native American cancer patient population. And we'd like to examine the integrative model of oncology care and recognize the benefits of combining traditional healing services in the care of Native American cancer patients. So there is an estimated 4.5 million people classified as American Indian or Alaskan Native, and that represents about 1.5% of the total population. There are 560 federal and 100 state recognized tribes nationally. So this is data from the CDC in 2015, and the national all-site incidence is lower in Native Americans than non-Hispanic white patients in both men and women. Interestingly, particular cancer types are higher in incidence, including colorectal, pancreas, stomach, and cervical. What should be appreciated when analyzing Native cancer incidence is the magnitude of cancer burden among Native Americans may be incomplete, and it may be compromised, and this is due to several factors. Significant levels of racial misclassification, underreporting of cases, reluctance for patients to divulge to researchers and cancer surveillance personnel a cancer diagnosis, and insufficient databases in general may all lead to lower levels of reported incidence. It should also be recognized that the incidence truly seems to be rising in the Native American population. However, this may be attributable to increased screening over recent decades. So although the overall incidence is lower in the Native American population, the cancer-specific mortality is higher. This is from the American Journal of Public Health in 2014. And here, they calculate the mortality to incidence ratio in Native Americans and Alaskan Natives compared to non-Hispanic whites. It is clear the mortality is higher in all cancer diagnoses across the board. What is still unclear is why higher mortality, cancer-specific mortality, is observed. This may be related to a diagnosis at later stage, among other factors. So what are the risk factors that may have particular contribution to cancer pathogenesis in the Native American and Alaskan Native population? Certainly, tobacco plays a significant role. In 2005, 32% of Native Americans smoked, which is higher than any other ethnic group. Additionally, the highest rate of tobacco usage are observed in youth, aged 12 to 17, compared to other ethnic groups. It should be noted this may be overrepresented, however, as most of the surveys evaluating this do not separate habitual use versus ceremonial use. So this may, in fact, be falsely elevated. Other factors include alcohol use, diets high in saturated fat and low in fiber, fresh fruits and vegetables. There may be lack of regular physical activity, obesity. Geographical factors may be playing a role, including environmental exposure from cattle farming runoff or agricultural chemicals. There are also barriers to prevention and care. There's a lack of awareness of cancer risk, a lack of awareness of screening options. There may be distrust of medical systems and research in general. There may be fear of screening tests or the results of those. There may be health beliefs that may conflict with prevention practices or geographical barriers to prevention and specialty services. And finally, financial burden that's associated with these types of services. What are some of the cultural barriers for cancer care? And There are 217 Native American languages spoken across the nation, and most, in fact, do not even have a word for cancer. In the Navajo language, cancer means a sore that does not heal. So this may lead to reluctance to seek evaluation for symptoms due to fear and misunderstanding. What about the community and system level barriers? There's underfunding within urban and tribal health systems. There's lack of accurate population-specific data. There's high rates of poverty, poor access to health care due to low rates of health insurance, and limited availability of prevention programs, screening, and specialist care. So this is an article entitled "Poor Cancer Care for Native Americans Might Be a Treaty Violation," and this was just published last week. And in this article, the author claims that tribal treaties, which state Native Americans should receive all, quote-unquote, proper care and protection, are not being honored due to the fact of federal dollars from IHS to support cancer care. And although this is truly an editorial piece and may be quite controversial, I think it highlights the state of cancer care in our nation and demonstrates that it is recognized as an issue and as something that needs to be addressed. So in summary, lower overall incidence is observed in Native American and Alaska Native populations, but a higher overall cancer mortality. There are cultural barriers to prevention and care, and there are community and system level barriers to care. So the future of Native cancer care looks like this, we hope. Improved prevention and screening, leading to decreased incidence. Improved cancer care in general, leading to decreased mortality. Genuine respect for the culture of the Native cancer patient, and a whole person approach, including body, mind, and spirit. So I'd like to move to our second objective, and that is to examine the integrative model of oncology care. So let's take a moment to define what is integrative medicine. And that is this: the practice of medicine that reaffirms the importance of the relationship between the practitioner and the patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic approaches, healthcare professionals, and disciplines to achieve optimal health and healing. So what are the components of an integrative oncology care model? And that is optimally to include medical oncology, evidence-based, standard of care medical oncology, with many supportive techniques, including lifestyle counseling, including diet and exercise education, naturopathy, native plant medicine, Chinese medicine, acupuncture, spiritual support. These are just a few components of what the integrative oncology care model could include, but there are many others, including biofeedback, massage, music therapy, art therapy, and many, many more. So in the integrative oncology care model, patients would be recommended for surgery if indicated, chemotherapy if indicated, or radiation, but paired with optimized supportive care, with optimized nutrition, exercise counseling, and spiritual support. So in the integrative oncology care model, what we hope to do is to optimize supportive care during treatment and beyond. And our goals are to enhance quality of life, to decrease the treatment-associated side effects, such as chemotherapeutic or surgical or radiation toxicity, to promote wellness and optimize the survivorship, and even potentially to enhance response to therapy. So now I'd like to introduce Roberta Basch, who is our Native Outreach Coordinator here at the Salish Cancer Center. And she's going to spend a few moments recognizing the benefits of combining traditional healing services in the care of Native American cancer patients. So I'll move it over to Roberta. Thank you, Roberta.
Thank you. First of all, I want to thank you all for being part of this presentation here today. We are really honored that you are taking part of this presentation. I'm going to talk about Native healing in the integrative model of care. First of all, here at Salish Cancer Center, we have unique treatment goals in the Native American population, which are overcoming negative patient experiences and gaining trust. And secondly, overcoming historical trauma related to healthcare and boarding schools. Let's explore these two goals in more detail, and then we'll also share other areas that we are impacted by and what we are doing to help Native patients to overcome these areas. To overcome negative patient experiences, we placed a major emphasis on emphasizing training for staff on Native historical trauma. At this juncture, we are creating an onboarding staff training video that discusses the history of historical trauma in the Pacific Northwest, but is also very common throughout the United States. These experiences are very common as it relates to the historical trauma that Native people experienced in hospitals and the education system in boarding schools. And it's really important that we recognize that Native belief systems regarding health and healing were disregarded in these experiences. The culture and Native people were treated with disrespect. We'd like to place examples of these stories that the elders tell within our video to help our staff gain experience with dealing with historical trauma. One story that I'd like to share with you that I'm sure is very common throughout Native country is told by a Native person that I recently met. This Native person was a patient at a very young age. He says 4 years old. I met him at a medicinal plant workshop, and the facilitator started to tell a story about this little boy, and he said, "Hey, that was me," and at this time he was 92 years old, and he's still with us today. This elder said that he had boils on his legs, and he went to the local doctor, and the local doctor tried different remedies to treat him, and they were unsuccessful. He was referred to the Cushman Hospital, Indian Hospital here in Tacoma. And on the first visit, that provider told him that they had already done what he was going to do, so he wanted to do surgery, and told the family that he can do surgery the next morning to amputate both of his legs. Of course, the family decided right away that that wasn't going to happen, and the dad said, "Well, I should have taken care of this myself." He lifted up the elder, and he brought him home, and he placed herbs on his legs, and within 3 days he was completely cured. These stories continue to be told today, and there are massive stories. There are many, many people out there with these kind of stories that impact how Native people feel about medicine in general. The effects of historical trauma that we can see in our patients include alcoholism and addiction, fear, mental health issues, inhibitions of communication, and most of all, rejection of the modern health system. We strive to overcome the barriers and place emphasis on gaining trust through providing an optimal Native healing environment. So what does this mean exactly? We work to help staff become empathetic and compassionate. We assure that they show respect to the Native patients. In the Native world, respect towards self and their relationship to the world is primary. We are laying the foundation of respect and trust for all Native patients and all the people that we come in contact with as we are providing medicine here. We work to help staff understand various Native communication styles. For example, silence does not mean disregard. In the Native culture, it may mean respect for others. We have had incidences where young people may enter our clinic and not look at the provider in the eyes. And to us, that may mean that it is with great respect that they are hearing other people. And then also that the person may not give direct feedback right away. And this could be because they are thinking about what is being communicated, and they'll respond after fully analyzing their information within their cosmology, which may take a few seconds or much longer, even a day. And then they will come back with a response. Most Native people have extremely close family and community relationships, and together they will make a decision. Sometimes they will hear the information and come back with a decision or a response the next day. We often find that Native families who come through our doors come as a large group. Privacy of personal and family information is important as well. And we find that many of our patients do not want to share the information. And so we provide caring staff that will wait for the patient to provide information in order to provide better services. Eye contact, we just talked about that. But it's important to let the staff know that these communication styles do not represent all Indian people. Some of the Native people that come to our clinic are very traditional, and others are not. Others are very highly educated and have worked and lived in the urban communities. So you can't lay an overall picture of how to communicate with different Native communications, but to be open to various communication styles. And finally, we work to assure that we are providing an environment that is conducive to Native healing. We work hard to train our staff to be compassionate, as we've said. Our environment, we have placed Native art in healing areas. We provide Native music in the background. Our Native cultural specialists, including the registered nurse that helps to provide a soft landing for Native patients. Native outreach is used to build collaborative relationships within the community and to provide education to staff, and also to staff in hospitals that we refer our patients to. And what I mean by that is we have had patients that have entered into the hospital and our spiritual, traditional Native healers are called on to do some work there. So we provide orientation to the hospital staff. We let them know that the spiritual healers are coming and that they can expect that there'll probably be some smudging and some prayers going on in the room, and hope that their alarm systems would be at least disarmed temporarily to make room for this. Probably the most important thing that we are wanting to help staff with is to understand respect, the respect that Native people have for the cosmology as it relates to health and well-being. We offer Native traditional healers to support, as a support option, who provide healing methods for body, heart, and spirit. Specifically, they can offer spiritual healing, spiritual counseling, native plants and food recommendations, native plant medicines. Regarding native plant medicines, we have found that many of our healers will make a recommendation to a patient, but that recommendation, that plan is also being prescribed by a naturopathic oncologist. So we have created a policy that bridges the gap wherein our native healer will make that recommendation to the naturopathic oncologist. They will actually make the prescription to the patient as not to duplicate the medicine. Native healers also provide ceremonies and rituals, and this will expand well into the future. Native traditional healers come from various tribes throughout the United States. All of our patients, Native and non-patients, are given an opportunity to supplement their healing process through services offered by Native American traditional healers. In fact, the majority of our patients seeking to see a traditional healer are not Native. Our Native patients live within the community, and they seek healers that will come to their home, which is a normal practice. But we do have some Native people who would rather see our spiritual healers, our traditional healers here. And just knowing that our traditional healers are welcome here and are seeing other patients here in this clinic gives them a sense of satisfaction and security. There is always a wait list for people to see the healers. At any given day, there are 15 to 20 people on this wait list. At this time, traditional healers come in 2 times per month and see patients throughout the day. Healers that recommend herbs and teas, as we discussed, coordinate the recommendations through the naturopathic oncologist to avoid duplication. We have found many recommended supplements are prescribed by the naturopathic oncologist. We have to do some training for the patients that are used to seeing a traditional healer, in that they will not be taking this same recommendation, plant medicine, through a tea or putting it in their food. They'd be using it in pill form, which is new to many of the Native people that we see. We found it necessary to emphasize meeting the specific financial counseling needs as well. We provide training to our financial counselor on financial considerations. Native cultural specialists help providers to understand Native American health care in terms of provider systems and insurance, specifically in regard to the Indian Health Service, and also by specific tribal support that tribe gives to individual patients, which require considerable research. This concludes the area on overcoming barriers to treatment by offering a Native optimal healing environment. And moving forward, I am introducing to you Dr. Eiko Klimant, who is our medical director here at Salish Cancer Center.
Thank you for the introduction, and thank you for having us on your webinar series. Thank you for the opportunity. So I would like to talk about the Salish Cancer Center approach, addressing the unique needs of our Native patients. So in terms of the philosophy of our center, we combine medical oncology with evidence-based integrative therapies. that is called Integrative Oncology, which is somewhat of a new specialty. Then our team consists of 2 medical oncologists, 1 nurse practitioner, 1 naturopathic oncologist at this point. We are looking for a second one, and a Chinese medical doctor, an acupuncturist, and as Roberta explained, very respected and experienced native healers that come to our center. So what we offer is, in terms of our services, is state-of-the-art medical oncology treatment with 23 infusion chairs in combination with the other integrative treatment modalities such as naturopathic care, acupuncture, Chinese medicine, IV vitamin infusions, native healing, and survivorship services as well. Our patients are native and non-native patients of all cancer types, with the exception of acute leukemia. Here's our team, and the patient is at the center of all the services. So I would like to briefly touch upon some of our major initiatives that we have worked on. The first one is our focus on patient care excellence, where we are developing collaborations with community partners to optimize the patient's experience in our center and also with our collaborators. I would also talk about the significance of a state-of-the-art electronic health record system. The second major topic will be our survivorship program, with a program development that has been started, where we focus on the continuum of care for the cancer patient, which starts with diagnosis and goes far beyond towards end of life. The third topic will be research and our approach to research with community partners and our key areas of focus in research. So our focus on patient care excellence. We are providing evidence-based standard of care oncology where we adhere to national guidelines, like the NCCN guidelines or the ASCO guidelines. ASCO is the American Society of Clinical Oncology organization, which is the largest organization in the world addressing cancer care. And so our philosophy is to practice evidence-based medicine, which means we look at the best evidence for any treatment modality that we offer our patients. So, which includes high-tech medicine like chemotherapy treatment or biological treatment in combination with radiation therapy and cancer surgery. We add to that optimized supportive care with an integrative approach, which includes addressing the patient's dietary needs, supplements that the patient may take or not take. At times we advise for supplements, at times we advise against supplements depending on the individual situation, which would also include Chinese medicine with acupuncture as a part of optimized supportive care. We feel that the combination of these integrative modalities, in addition to high-level standard evidence-based care, creates better outcomes for our patients. So it's not enough to just treat the tumor or the cancer aggressively. We also need to make sure that the patient is strong enough to tolerate the at times aggressive therapies that are needed to treat the patient's cancer, in particular if we want to cure the cancer. Hence, having an optimized supportive care approach, an integrative approach, does overall improve outcomes. The third point, the new electronic health record system that we are working on and have decided to implement is very important for the first 2 points as well, which means we will have and already have a high level of documentation in our medical records to capture patient outcomes, which ultimately is needed to show the value of care. we intend to make a difference in healthcare and integrative oncology. Hence, it's very important for Salish Cancer Center to be able to show what we do different and how that difference translates into improved value in the care of the patient. Fourth point in terms of our initiatives to have an excellent patient care experience is that we develop collaboration with community partners such as the Franciscan, Multicare, Group Health, which are local healthcare providers, to ensure a seamless experience for our patients. So my second major topic today in terms of the Salish initiative is the Survivorship program. So currently there are 14 million survivors as of January 1st, 2012 in the United States. And the projection is that by January 2022, there will be 18 million survivors. So that's a huge amount of patients that need expert care. Who is a survivor? Anyone who has been diagnosed with cancer. The timing of survivorship is applicable at the time of diagnosis through the rest of the patient's life, which can be many, many years, could be 30, 40 years at times. How is survivorship delivered? It's embracing the life of the patient beyond the illness, and we'll later talk about how Salish's approach is to survivorship. Everybody who is touching the patient, like family members, friends, caregivers, are also impacted by the survivorship experience. It covers the physical, psychosocial, economic issues of cancer from diagnosis to end of life. Other issues related to survivorship is the access to health care and follow-up treatments, managing late effects of treatment, second cancers, and quality of life. So here are four major areas of cancer survivorship, which is surveillance, screening, and prevention of recurrent and new cancers, identification and management of late and long-term effects of treatment, recommendation and promotion of improvements of modifiable health behaviors. For example, lifestyle changes or dietary changes are in the category of modifiable health behaviors. And lastly, coordination of care between providers that take care of a patient who is a survivor, and also the coordination of care between patient and the provider to ensure that all the patient's health care needs are met. Here's a diagram of survivorship, top in the middle, prevention and screening towards treatment, which is cancer treatment, followed by post-treatment care. And part of providing a good survivorship program is to develop care plans and treatment summaries for the patients, which the patient can always refer to and can also share with his or her primary care provider. Another important aspect is multidisciplinary wellness promotion, diet, exercise, spiritual care, and joy optimization. I love that term, joy optimization. So at Salish, we do want to deliver and provide an integrated survivorship program, so which includes the medical care plan, which includes access to activities such as native drumming and meditation, native spiritual healing, acupuncture, naturopathic medicine, nutritional education, Tai Chi and Qigong classes, massage, counseling, online classes, and native healing practices as part of the program, which is all in development. The third topic of Salish initiative is research. The Puyallup tribe is very enthusiastic about research and is very supportive for the Cancer Center to develop research programs. We're looking at four major areas, which include medical oncology, integrative medicine, cannabis, and the Native American aspect of research. As part of developing a research program, we want to participate in community-based research networks and develop programs in these four major areas. Currently, we have collaboration with Krisstina University, which is a naturopathic university, and the Mayo Clinic in Arizona through Dr. Gowin. We are participating in the Crucio study, and through Dr. Gowin, we're participating in a clinical trial for yoga in myeloproliferative neoplasms, and as well as a clinical trial for Tai Chi multiple myeloma during autologous stem cell transplant. So with the research, this particular project, we want to advance integrative medicine and build evidence base for integrative therapies. We want to develop research questions in conjunction with collaborative partners with a native focus, which includes, for example, surveys we can do, and based on survey results, we can further fine-tune research questions and create programs around those. We are also looking at building a research infrastructure, which would include a research nurse and a data manager. We will need services for statistical support, and this is all in the way of being thought about, envisioned, and part of our program development. So to sum up, Salish Cancer Center is committed to making a difference in the care of Native patients. As we talked about prior, Native cancer specific mortality rates are higher than average. Native cancer patients have many unique needs and risk factors that need to be addressed. We think that an integrative model of care can make a significant difference for Native patients, as this offers a whole person system approach to healing. The Salish Cancer Center is the first tribally owned integrative cancer clinic in the United States, offering high-level evidence-based medicine in combination with integrative services such as native healing. We are very excited about the opportunity to make a difference in healthcare, and we are very grateful for the support of the Puyallup tribe to make this all happen. If there are any questions, please feel free to contact us for any questions regarding the Cancer Center or any research interests you may have. Thank you very much, and now we think we have some time left for questions.
Thank you very much, Dr. Klimant. If anybody has any questions, feel free to go ahead and write your questions into the question box on the bottom, I believe the third to last window there in your GoToWebinar browser there. We'll go ahead and pause just for a couple of minutes here, see if anybody has any questions. Again, we do want to thank everybody from the Salish Cancer Center for presenting for us today. Very awesome presentation. And we'll go ahead and hold for just another minute or two, just to see if any questions happen to pop up. Not seeing any questions in there just yet. And we'll wait for another maybe 10 seconds or so. We just got one that popped in here. How can cancer organizations who serve many populations also make sure to be inclusive of the needs of Native American constituents?
So,
yes.
So you're asking how can a clinic or any clinic that sees Native and non-Native patients make a difference for Native patients? So it's a very good question. We feel that by providing a very high level of care using high-tech medicine combined with integrative medicine that has a native focus, that the native patients' needs will be addressed very well, including patients who are non-native who have an interest in this modality. So our focus is to provide high-level, actually the highest level of care for native patients by providing and creating the types of programs we discussed. And we will have to continue to monitor how is the experience of the patients, and based on the feedback, make improvements.
And maybe I can add a little bit more to that. As I think it's so important for the first step is to address the unique needs of the Native American population. You know, where are the barriers to care? Where can we improve our prevention and screening services? And address the spiritual needs of the Native American population, which is truly very often overlooked in our current model of care. And so I truly think that the first step is to pay respect to the Native American patient population and identify what makes them unique and what makes the challenges of offering optimized care in our current setting of oncology care model now. Did you have anything you wanted to add, Roberta, from a Native standpoint?
From a Native standpoint, and from visiting with many of our Native people who are receiving services here, they are very grateful that and find comfort in the relaxed atmosphere that we have here. And they report that it doesn't feel sterile to them, and that's important to them, that they are listened to, that time is taken with them as they are having discussions with their providers.
Great, thank you very much. And I'm just waiting around. Do you have any more questions here? One more just popped up. How do you recommend improving representation of Native Americans in cancer clinical trials?
I think that's a very thoughtful question, and I think it certainly highlights that the Native American and Alaska Natives are truly not represented in our clinical trials occurring now. And so I think, again, the first step is to bring this to the awareness of the principal investigators, the researchers, that there is this ethnic minority that we truly have no evidence base to guide our decision making. And so once this becomes identified from the research standpoint within the primary investigators, I think that starts the process of momentum, moving that forward, identifying it as a unique need within our medical research. And I hope that we're doing that here, that we're starting to improve the awareness, to bring this to the awareness of the researchers out there. And then certainly funding, and I think that it has to come from some of our national centers, from the NIH, to start bringing forth initiatives to fund these sort of studies. And so I think anyone and everyone can start making a difference in this, and that's just bringing this need to the awareness of the people who need to know about it.
Yeah, there's definitely a lot of room for improvement to create a better access for Native Americans to research trials, and also create projects that are focused on asking key questions that address the Native American population. So the data out there at this point is limited, so there's a lot of room for improvement and projects in that space.
Awesome.
Any other questions?
Just waiting for another question to pop in here. We'll give them maybe about another 15 seconds.
Well, maybe, Mike, while we wait, maybe I can jump in a bit and just kind of building off of the last question regarding research, that I'm personally very passionate about moving the research ball forward, and we all are here at the Salish Cancer Center. And so if anybody out there who is interested in talking about what kind of surveys can we do, what kind of partnerships can we begin to create and collaborate to start moving the research forward in this field, I'm very happy to have discussions with you and even brainstorm ideas. So you see my email on the end of our PowerPoint presentation, and please don't hesitate to reach out.
Awesome. Thank you very much. And it doesn't look like we have any questions that are coming through, so I think that this will probably be a good time for us to wrap up. We do want to say thank you very much to everybody over at the Salish Cancer Center for presenting for us today. And we will send a brief survey monkey within the next 24 hours or so. If you are planning to obtain CEUs for this webinar, complete the evaluation survey in its entirety within the next week, and we'll go ahead and get that sent out for everybody. Please visit our website at www.keepitsacred.org to find this and other technical assistance webinars, as well as many other cancer and commercial tobacco prevention resources for tribes and tribal organizations. We will go ahead and make sure that this webinar is archived on our website at www.keepitsacred.org. Also, be sure to follow us on Facebook at facebook.com/keepitsacred and on Twitter at keepitsacred, and we'll go ahead and post the update when we get the webinar archived and uploaded to the website. Again, we want to thank everybody very much for attending the webinar, and have yourselves a wonderful rest of the day. Thank you very much.
Thank you.
Thank you.
I think you did really good.